Hello and welcome to Earth is Waking Up. I'm your host, Jeremy Anderson. Today, our guest, Dr. David Rosensweet, is a graduate, or welcome first off.
Yeah, thank you, Jeremy.
uh, Dr. David Rosensweet is a graduate of the University of Michigan Medical School. He's been in private holistic medical practice since 1971. He trained some of the first nurse practitioners in the United States, was in charge of health promotion for the state of New Mexico, and was the chief investigator of a hormone study for an American reference laboratory. He lectures widely and teaches and mentors medical professionals in menopause medicine. He is the medical director of the Menopause Method. Again, welcome, David.
Thank you, Jeremy. Good to be here.
Yeah, I love that you've been a leader in this field for a long time. And so one of the things that stood out to me is that you're aware of the science on in the whole field, not just on the mainstream practice, but also a more holistic perspective. And I wonder if you could talk a little more about that experience and how you not just stuck with the mainstream allopathic route on that.
Well, I graduated a long time ago. And when I did, I went into general practice. And right out of the gate, a couple monumental things happened. I realized I was a physician that was most likely going to need to heal myself to have any value. That was big. And then also, at the time, I was just interested in adding tools. I mean, some of the old timers had special tricks that they used. We used to call them pearls. Like they would inject B12, and other old timers had some knowledge about nutrition. So from my perspective, I was just trying to gain information on how to help people heal and how to help myself heal.
Yeah.
And, you know, eventually I had a lot of different mentors and teachers, and that's how it was done in those days. And years later, they started calling it complementary medicine or holistic medicine. But to me, it was all good. And in my world, there was good doctors and there was not so good doctors. And the good doctors were great and great at what they did, and they're very special, gifted people. In fact, the whole medical profession, from janitor to hospital administrator, surgeon, neurosurgeon, there's great people in there, devoted people, caring, loving people. And there's some people who, you know, you probably wouldn't want to run into them too often.
All right.
But I just had the great fortune to grow up amongst good doctors, good health professionals, and that's where I've been living for a long time.
Right.
In that world. And I was always inclusive. I never saw the special province of healing being just medical doctors. I thought we had a certain amount to contribute, and I loved my background. God, the biochemistry, the physiology was phenomenal, and the experience with the patients was invaluable. But I got very interested in nutrition. I got very interested in the toxicity that we were exposed to. And this, I'm talking 40 years ago, 50 years ago, there was already trouble with toxicity. Yeah. And I was very interested in exercise. And I became very interested both professionally and personally to how we respond to stress. Because when you look at how people get unwell, that's the elephant in the room. It's not so much the stress of life, but if you trigger the biology of the stress response and you keep doing that, you run into biological difficulty. From my perspective, when someone's not well, we're really trying to focus on, what's going to help them heal? And it's going to come down to the same thing for everyone. They've got to really become expert at nutrition, their own and supplementation and exercise. They got to do that one right. Not too much, not too little. Some people have more than others have to detoxify. And the big one is we've got to live life. Life is really good for health.
Oh, yeah.
Living is great, and not doing a facsimile of living where we can drift off into life guided by uncomfortable choices, inappropriate choices, gets real stressful. As we move ourselves towards living and the pleasure and the fun and the love that's available in living, that's the big medicine. That's what's available to us, the humans, the beauty and the love and the connection, that's what gets us to heal. And one of the principal barriers in that is, especially at this stage of human evolution, is the challenge folks have around our emotions and our mind and repression. So those are the things I got interested in.
Uh-huh.
Those are the things I brought to my patients.
So interesting. So I guess I'm curious what led you that direction. If it was some of your personal work, or if it was more I don't know, just feeling like you wanted more to offer your patients, like more love-based.
It was a real several factors. One was a genuine curiosity. I kept on seeing some of the medical interventions, the medications, the surgeries, as late-stage attempts to remedy rough physiology and real illness. And that wasn't my major interest. That is the province of emergency and critical care and internal medicine doctors and surgeons. And God bless them, they're doing that.
Yeah.
And some of them are doing a fabulous job of it.
Yeah.
But my interest was, well, how do we get ill? I mean, I'm seeing real patients. They're sitting in my office, and here's what they want. They want to get better.
Yeah.
I discovered that pretty early on, right? And then if you're not going to treat them with medications because you're not handling their emergency stuff, how do you help them? So it was a curiosity, and I just was curious about nutrition. I suspected that the faulty nutritional stuff was getting them into some biochemical and some hormonal issues, and I understood the biochemistry and the hormonal. So it wasn't hard to, for example, to see someone that was eating an excessive amount of sugar and sweets, what the heck that does to insulin, glucose, insulin resistance, adrenaline, cortisol, weight gain. The biochemistry and physiology is very clearly mapped out. And that's really the biology of the stress response too. So you start getting into that issue, and then you can help them with nutrition. You can say, well, stop eating all sugar. And that's not enough, because folks are eating that sugar to medicate themselves. They're feeling low, so they are seeking out things that'll help them feel better. They don't like feeling not good, so they'll choose various substances, medications, drugs, all kinds of addictive substances, and especially sugar, to make them feel a little better. So then you start asking the question, if you're feeling low and you don't want to use sugar, what are you going to use? So you get into the anatomy of what constitutes not feeling good, the uncomfortable emotions, and the uncomfortable thoughts. So then the medicine becomes, do you have tools to deal really well when you drift out of your happiness and into your fear, sadness, anger, shame, guilt, emptiness, loneliness, meaninglessness, hopelessness, that whole spectrum of uncomfortableness? How skilled are you at dealing with those in a productive way, and being so skilled that you don't trigger the biology of the stress response as you are drifting into those stressful states?
Yeah.
And then the second thing was, I had what I would call a catastrophe in my life. I was married, I had a son, and I was not successful at that marriage. And on the divorce, and then a second divorce, I really broke down. I realized that I'm a man who does not know how to love. I did not know how to love a woman. I knew that I was the primary cause of the dismantling of those relationships. And that was humongous. The first divorce, I didn't get it. The second one I did. I just repeated the same pattern I did the first thing. And this is about me and all the dysfunctionality, all the uncomfortable beliefs and behaviors and choices and communications and non-communications and projections that I brought to those relationships. You dismantle them molecule by molecule. Well, that was a big deal because I love being a doctor, but the thing I loved the most was being in a marital relationship. It was loving a woman. So to break down there, that was huge for me. And so very early in my life, in my mid-30s, I devoted myself to what I would call personal growth teachers, seminars, spiritual growth. That, in fact, that's where we met, in one of those amazing, amazing experiences. And once I tasted some personal healing, it became my primary commitment in this lifetime. And of course, that's very bringable to people who are hurting in the same way, because, you know, human hurt's coming pretty much from the same well.
Yeah, for sure. So yeah, because if we're still hurting, then we're not going to be able to support others through that healing process, and then we'll stick with just the science that's given us through the system, and instead of a more holistic standpoint.
Precisely.
So I love.
Better living through biochemistry.
Yeah, right.
Boy, it doesn't work. That's the problem.
Unless it's the internal biochemistry. Our hippocampus gives us, the hormones that we need to be happy and thrive. So, so it sounds like you've come up with some strategies to support the body in healing itself. So one of the things that I'm aware of that you offer is called the Menopause Method. Could you talk a little about that, how it came about, and how it supports people in that more holistic perspective?
Well, it was by serendipity, as so much of my career has been guided by that. About 25 years ago, one of my patients I had a holistic medical office at the time. She slammed open my consultation room door. I was in there alone, thank goodness. And she was angry, and she was in her mid-40s, and she walked up to my desk and she pounded her fist on my desk and said, and she was very upset. And I knew that this was a brilliant woman. She had retired in her mid-40s, that she had been so successful in business. Wow. And she said, "Don't think you know me. I'm going crazy, and I mean it. And don't pretend like you think I'm the same person you know." And serendipitously, I had been a couple weeks prior to that speaking with an expert on progesterone, one of the female hormones. And I put two and two together, and I gave her some progesterone, and 3 weeks later, she wrote me a letter. That's what happened in those days.
Yeah.
And it said, "My God, man, what was that? I'm totally myself again." And thank you so much. And that was so dramatic, because it's not often when someone comes in major duress and you give them something and they have that dramatic a response.
Yeah.
But I've never really guided my career on purpose so much. It just unfolds. And, before long, I was seeing more and more women in menopause, and I was seeking out more knowledge. And I pretty much figured out that if I was going to figure out hormones, I was going to need the women to do it. I would need to do it with the women. Yeah. So I published a list of symptoms of insufficiency and excess, and gave them the hormones, and they started low and they gradually increased, and it alleviated their symptoms. And I figured out dosing that way, because there was very little information back when I started.
Yeah.
And I was, by then I was so into organic and nutritional supplements that it was a natural for me to choose these bioidentical hormones that had recently become available. Same molecules in a woman's body, derived from plants and put together by compounding pharmacists. So I was treating them with that. And I was getting these remarkable results, and that's very rewarding.
Yeah,
And I noticed that, you know, some of the more chronic illnesses, they're a slow go.
for sure.
It can be a very slow moving train with a lot of, well, in menopause, you have basically a lot of empowered women that crash around menopause. And if you treat them properly, and it's a process to do so,
Yeah.
they're back into their healthy and living and empowered living. And that seemed like fantastic leverage to me.
Uh-huh.
And so we just continued, and then I went into, my son joined me, and we built this whole method. And now we spend most of our time training and mentoring physicians, nurse practitioners, and PAs who are treating women in menopause with bioidentical hormones. That's the main thing we do.
Wow.
And it
So,
was called the Menopause Method. And since my daughter is on, as one of the partners in our whole enterprise, she's been saying she didn't like the word menopause so much. It has such negative connotations. So we're playing with the word for our business called Hey Lively.
oh,
The first public announcement of it. But I want to throw it out there. It gets if anyone wants to give us feedback. But the name of what women would encounter was a practice name called Hey Lively. Anyway.
yeah, I love it. I think I had a similar, when I first heard the name, I was like, oh, like I knew right away what it was, but also was like, the name, it's not super appealing.
Right, exactly. And the other thing we did is, by accident, about 15 years ago, the pharmacist had sent some hormones to my office rather than to the patient. And I went, look at this. I've been treating women with hormones for 10 years. I've never seen the actual hormones. And I opened up the jar, and there was a strong odor to it. And I went, what's that? And I investigated it, and I saw that these hormones were being put up in very strong solvents. And I did the math, and here I am. I'm a holistic doc. I'm teaching people how to detoxify. And meanwhile, when you do the math, I'm asking them to rub a quart of this toxic solvent into their body every year. So my son and I, pretty soon after that, came up with an organic oils carrier for the hormones.
Nice.
So that's what we offer, and we have 25 pharmacies around the United States dispensing bioidentical hormones right now in a certified organic oil mix.
Oh, great.
We have a
Wow.
patent on
That's got to be rare on the market.
it. It's the only one that we know of, and it needs to not be rare. So,
Right.
yeah.
I'm glad we're talking about. So while we're on the topic of hormones, that can be a controversial topic. Can you kind of uh, de uh, declassify it, kind of explain it out for us a bit?
It's controversial only because of false reasons. I mean, women have been treated with hormones since the 1940s. There was a pregnant mare urine estrogen. They were extracting estrogens from pregnant horses. It's called Premarin. It went on the market in the 1940s. And by the 2000s, there was 18 million American women on these hormones.
Wow.
And you talk to any of those women, they love those hormones.
Uh-huh.
They made a life-changing difference for them. And there was also another one they were on. It was called Prempro. Well, what the pharmaceutical industry understood and what doctors knew is that these hormones were not only good for alleviating women's symptoms, menopausal symptoms like hot flashes and sleep disturbance and mood disorders, etc. They knew that it was good for protecting the heart.
Mm-hmm.
Because what was known is, you never hear of a young woman dying on a tennis court, 40-year-old woman, but you do occasionally a young man, never sick a day in his life, had a heart attack and died in his 40s.
Yeah.
And the difference is the protective nature to the coronary arteries of estrogen.
Huh.
So one of the purposes of the study that was done was to show doctors that they should be treating more women than just 18 million. Premarin was the most popular drug and most profitable drug in history at that time.
Wow.
And the study backfired because of craziness. It was the most expensive study in the history. And one of the members of the study committee had a vendetta against women and hormones for a decade. And he got onto that study committee, and he did a preliminary look at the results and made the statement that one of the two hormones, the one that was not Premarin alone, but Prem-Pro, was Premarin combined with this medroxyprogesterone acetate, had an increased risk of breast cancer. So he called together the committee, said, we've got to let people know about this. And the study committee said, no. The data that you're showing us is not statistically significant. There is no statistical significance to an increased incidence. We don't have any proof of that at all.
Huh.
And he said, I'm sorry, it's too late. I've already sent it to the Journal of the American Medical Association, and it's been printed, and it goes on the stands tomorrow or something. And the committee, some of the committee members got furious.
Yeah.
It was too late. It had made it into the Journal of the American Medical Association, JAMA, and the press got a hold of it, and it exploded out into the world that if women taking hormones are at increased risk for breast cancer.
Uh-huh.
And it exploded.
Wow.
And who picked up on it? Women and physicians.
Uh-huh. And
everyone got freaked out. And there was no putting the cat back in the bag.
Yeah.
And from 18 million went way below 5 million almost immediately. There's 50 million American women in menopause.
Wow.
And it's gradually creeped back. Well, by 2006, they had proof that there was no increased risk. They published it. No one heard of that. You didn't hear about it. That's not what you're talking about, the controversy. No one heard that. In 2017, in the Journal of the American Medical Association, the original committee published an article saying after 18 years of follow-up of all these women, there was no increase in breast cancer, heart attacks, or stroke in the treated group.
Wow.
Nobody heard of that. How many people heard of that? There are physicians and movements to get this out into the public, but you're no exception. There's very, very few physicians who are familiar with this. Over there is a book, and I'd really like to recommend this book to anyone who's concerned about risk. It's called Estrogen Matters. That famous shipping catalog company carries this, name not to be mentioned, after a Brazilian river. I'm going to put this in the chat. And this is the expert. You don't have to take my word for it. Dr. Blooming, who wrote this book, and Dr. Tavris. Dr. Blooming's an oncologist. There's 450 references into the medical literature. He explains the glitch. He explains the politics. And most of all, he explains this. And here's the medical science as we know it to be. That women treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are untreated.
Nice.
Women who've had breast cancer are at risk for increased risk for recurrence of that breast cancer once the cancer is treated, but they're at less risk for recurrence if they're treated with hormones than if they receive no treatment at all or they receive tamoxifen. Radical.
Yeah. Wow.
Women treated with hormones, no matter what they are, horse urine-derived estrogens.
Wow.
They're at less risk of breast cancer than women who go untreated. So that's the medical science. Now we're all at risk for 1 million diagnoses. Every one of them. I'm glad I woke up this morning and I'm walking and talking.
Right.
We're all at risk for cancer.
Yeah.
Men are at risk for prostate cancer and a few others. Women are at increased risk for breast cancer for a lot of reasons, including the toxicities that are out there, and they happen to be fat soluble, so they go to the breast. But that's a whole other story. We're at risk, but as far as women go, they're at less risk for breast cancer if they're treated with hormones. That includes both of those hormones that were used in that study, horse urine-derived estrogens and horse urine-derived estrogens along with medroxyprogesterone acetate. So
Yeah.
that's the medical story. And read Dr. Blooming's book. There it is in the background there.
I'm sure that's probably got some studies in it.
450.
Okay. Yeah.
So if someone really wants to know, where did he get this information? So he's lecturing around the country and trying to reverse what one of my pharmacist colleagues called this morning, how Satan got into medical care.
Interesting.
It's a horrible thing because women who are not treated with hormones, it's not even an issue about whether they're at risk. There's a near certainty that they're going to lose the health of their vagina, their bladder. They're going to be in adult diapers called Depends. They're going to lose their libido. They're going to lose their muscles. They're going to be in canes, wheelchairs, walkers and wheelchairs at the point of wheelchair. You move out of the family home into assisted living and nursing homes. The consequences are enormous.
Yeah.
Not being treated. Fractures, osteoporosis, coronary artery disease. Women without estrogen have the exact same incidence of heart attack as men. So half the women who are dying of heart attacks. They're not dying of breast cancer. They're dying of heart attacks. So the consequences of not getting treated, and you can look around at the older women, you'll see it. And there's a certain older women you won't see because they're off in nursing homes and in living. So it's a big deal. And we've got a whole team and colleagues everywhere and collaborators and we're on a mission to see if we can assist women to get 50 million women.
That's amazing. So I love that you're not just a doctor on your own, lone wolfing it, hoping to make a difference with just those few people that you interact with, but you're creating a movement.
Exactly.
And so for the listeners, what might be some of the basic symptoms that they might notice that they could find benefit by working with your program, whether it's through you or one of the many doctors that you're training?
Well, when it starts hitting women, sometimes it's subtle and sometimes it's not. Like a woman, even as early as her 30s, she can start getting a little crampy, a little breast tenderness as she's losing her balancing progesterone. She can start having some minor sleep stuff, get irregular periods, lose some of her drive as her testosterone drops, you lose some of her libido, lose some of her decisiveness, lose some of her cognitive ability. These things can creep up on you, and many women have told me they didn't even notice it was coming until they got treated. Yeah. Then there's a precipitous moment when women's periods stop. 75% of those women are going to get mega symptomatic. They're going to get hot flashes. Not such a big deal, not pleasant, but when they get a hot flash in the middle of the night, they wake up, and coupled with other reasons for sleep disturbance, loss of progesterone, they can't necessarily go back to sleep. And they start getting sleep issues, and you start losing a few nights sleep. That's it. Just think of yourself losing a few nights sleep here. And then the libido's gone. They're getting bad pain on intercourse. They're having intercourse. They're starting to get bladder infections. What I'll do is I'm going to give you an email address, and anyone who's listening can get a free PDF copy of our book. All they have to do is send me an email, say on it Jeremy/book, and one of our staff will get a PDF copy of our book, Happy Healthy Hormones, to them.
Oh, wow. Awesome.
Charge.
Wow.
You get a
Thank you.
paperback or a Kindle version on that Brazilian River Company. You know, the one that's named after the Brazilian River that I'm not the name of. That company does the printed version. This is it, and it really answers that question in with great thoroughness there, Jeremy, because I say that the more educated a woman is, that's why I wrote the book, the more she's going to be able to understand and make good choices around what's happening to her, and the more criteria she'll have for sorting out who she wants to go to and what kind of hormones she wants to get, and
Yeah,
participate actively in the process, because that's the way it works best, when she's an active participant.
for sure. Yeah, there's no magic bullet that just takes care of it. You know, just take
No,
this
you
pill
got to
and
get it right. There's a lot to it. You got to get the balance right. You got to get the amounts right. Women are very individual, so they vary according to how good the skin absorption is, how sensitive they are to anything you give them, how much they need as opposed to someone else. So there's a lot of moving parts, but it's very doable. Once someone learns how to do it, it's fun.
yeah. Oh, great. I think when it can be fun, we feel more lively and everything just works better. Our days go better. It's just, yeah. Instead of taking some nasty stuff that tastes like garbage and um, so a lot of these ailments, if you call it that, take a long time to build up to. And usually, I think I'm sure a lot of your patients come to you not having any idea for maybe years beforehand that this was building up until it got bad enough that they said, I got to go see an expert. I got to figure out what's going on. What's wrong with me? Like, fix me, right? And so, uh, can you talk a little about what the treatment looks like and how to kind of reverse that long over time buildup of the reduction of the hormone levels that lead up to it, the ramping up of the symptoms, uh, and how much time it takes to go through some sort of treatment, and maybe even some of the different types of treatments, because there might be some herbal things that can support, but they're probably not going to give the quick enough benefits for someone to really notice and get the improvements that they really want, right?
There's a couple really good observations in what the question you just asked. And it speaks to the variability of the onset. And we're approaching this interview today about the topic at this point around menopause, but the women, that's not how they're approaching it. Their life's going a little off. They're not as necessarily as happy. They might be a little more, it might take a year or two or three for a mood decline to take place, a year or two or three for libido, and they don't know what's going on. And these things are so gradual that I've heard many women say, like I was mentioning earlier, wow, it just crept up on me. And I felt vague. It wasn't clear to me. I thought, well, maybe I should be a better partner, or maybe I should look for a new partner, or, or maybe I got to perform better at work, but I'm having a little trouble. Maybe I should switch jobs. It creeps up on you.
Yeah.
And
And our minds play a big part of that mystery of trying to solve the problem, but not having all the clues. Right?
And the best that I could ever offer is one of the many missions we have. One of them is to increase awareness. So as far as this part of this interview, I mean, I'm doing a lot of this. It's a real opportunity for us to let women know that if you're not feeling tip top and you can't think of any obvious reasons, and you're in your 30s or 40s, think of hormonal loss and imbalance, because you don't have the same levels that you had when you were 20, and
Right.
neither do men.
Yeah.
And then again, the other part, the way that it happens, it's abrupt and the symptoms are raucous. And so those women, they're going to ask around, they're going to tell their friends, God, I'm having these hot flashes. What in the heck are those? And there's enough common knowledge. And you know, the common knowledge is not with the young women who've never gone through it. It's with the older women who have. So if you're living in a village and you're talking to one of your older women in the village, they may be able to help you. Now, the other part of that was, how quick does it take?
Mm-hmm.
Well, the hormone depletions take place over time. And for every molecule of depletion, there's a readjustment internally. And so we don't think in terms of a really rapid process, but there's some women, they get on those hormones within a week, they're feeling so dramatically different that they're reporting, oh my God, this is amazing. In other women, it's 2 to 3 months. And for some of the changes that takes place, it could be 6 months, like the vaginal decline, the decline in vaginal health, the vaginal atrophy. You can be 6 months on hormones. So if you find me being vague, there's a variability.
Yeah.
How quick it is. But yeah, some women, there was a time when I had a brick and mortar office that I put some hormones on. When a woman came in the perimenopause, I'd start off the visit by putting some hormones on her wrist and have her rub it in so that she got to feel it during that office visit. That was pretty dramatic.
Oh, wow.
Many of my colleagues do this. And so it's variable, but these things are strong. Hormones are strong.
Yeah.
And because they're strong, you really want to connect with someone who knows what they're doing. And because there's so much variability woman to woman, to get individualized hormonal programs, you really want to get with someone who knows what they're doing. So this is one of our major missions of all the people that we're working with, is to develop a standard of care. Because let me tell you a few things to answer part of your question. Estrogens and testosterone, every woman's going to need it, and you want it to go topical. You want it to be, my favorite's an organic oil. Here's an example of a bottle of estrogen. Shake the bottle, turn it upside down, rub it into your forearms. You want it to be topical. That means it goes on the skin and other surfaces of the body.
Yeah.
That's the safest for estrogens and testosterone. Progesterone, you can do topical. DHEA, you can do topical. You can also do it by capsules. That's fine. There are creams and gels. They're the most common thing being dispensed by compounding pharmacists, but you can tell I'm a very big fan of not using these solvents, because you want to take these for the rest of your life. Another misconception out there. Rest of your life. You never want to stop taking these things. And you see women who are satisfied. They're not going to stop taking this. They don't want
Yeah.
to.
And why is that? So our bodies in our 20s, the hormone levels tend to drop, right?
Yes.
Throughout our mid-20s. And so this is a way to supplement that body to get us back to where we could feel more like in our 20s again, right?
Exactly. And we're at a time in human history where there's a lot of factors that play into an excessive decline of these hormones earlier in life than is optimal.
Yeah.
And part of that question you asked a while ago was, how about herbs? Well, herbs are medicines. I mean, anything that goes into the human body, it's either a food or it's a medicine. A food has molecules in it that are similar to what's in the body. A medicine relies on an effect on the body. So a medicine is usually strong enough that the body's going to have some reactions to that stimulus.
Yeah.
And the healing effect of herbs, for example, is reliant on the body having to react to that herb or that homeopathic medicine. But that's not a long-term solution from my perspective.
Okay.
The ideal thing with medicines, whether they're herbs or pharmaceuticals, is you use them for a strong effect for a short period of time. Whereas the hormones, you're replenishing the exact molecule that was in there. And that works. I haven't seen anything else that really works. There's a lot of people that would love to solve it with nutritional supplements. that would love to break away from having to go to doctors and get prescriptions. But here's a sneak preview, a strong opinion. I'm a heavily opinionated guy. That doesn't mean I know the whole truth and nothing but the truth. I do really love my own opinions.
Yeah.
Go for the hormones. There's no workarounds, especially for the long run.
Yeah. So could you say real quick that the reason that you value so much the organic carrier oil as opposed to the other solvents, and the difference that makes in the body?
Well, these hormones, estrogen and testosterone, are safe if you apply them to the skin or other membranes.
Mm-hmm.
But they've got to be carried into the skin. You can't take an estrogen powder and put it on your skin. The way that you get the pure hormone is it comes in a powder form. You got to take that powder and you got to stick it in something. Traditionally, you took a little powder and you put it in a lot of solvent, a gel or a cream. In fact, when you look at a jar of what's called hormones, let's say estrogens, for skin use, over 99% of what's in the jar is actually the solvent.
Right.
And a little bit of it is the hormone. Like, for example, 30 milligrams of hormone in 80 grams of solvent is a typical.
Yeah.
Well, actually, you'd multiply that by, it's probably more like 200 milligrams in 200 milligrams in 80 grams. But over 99% is the solvent.
Wow.
Solvent is a carrier that helps bring the powder that dissolves in it through the skin and into the blood.
Yeah.
But you get the solvent. 99% of what you get is the solvent, and these solvents have toxic potential. They're all derived from petroleum, gasoline.
Oh.
That's what it takes to dissolve this stuff.
Oh, I'm glad you transitioned.
The organic oils we invented, they're not a solution. They're a suspension. That means there's powder, just add it to the oil, makes it much easier for the pharmacist. And the only downside is prior to each use, you have to shake the bottle like that, turn it upside down and use it. That creates a suspension. It's a great delivery system. The oil carries the hormone into the body. And what are you dealing with? Oils that have had a zillion tests on them onto their safety. That's what we chose. Those are the oils mixed that we chose that have a big safety. A lot of studies done on them for their safety. So it's fine to absorb the oils, but it's not fine to absorb solvents.
Right. Yeah. No, I don't think anybody would want those. But when they think that that's the only choice available in the market, from their doctor, or the doctor even isn't privy to more natural therapies, or makes sense. So I'm curious how effective that it's still, I mean, it sounds like it still absorbs well. And I'm curious if you've considered a homeopathic solution as well. But it seems like that would be a lot tougher given that it's different for everybody.
Well, I'm very familiar with homeopathy. I studied it with a real living master in the United States and shared an office with him. And it just doesn't, in my experience, it just does not remedy menopause. And it doesn't supply the actual hormones, because your bones, your muscles, your brain, your arteries, your vagina, they need the hormones. And without the hormones, homeopathic remedies are medications as well. They're very sophisticated. They're very elegant. There's no actual molecules in a lot of the homeopathic medicines, but that's not going to remedy menopause. And when people think of menopause, they think of treating the symptoms. Mm-hmm. Let's alleviate the hot flashes. Let's help the sleep improve just by alleviating the hot flashes.
Yeah.
That's not what I think of. Of course, I want to help the women alleviate those disruptive symptoms, especially when they're occurring at night. But I'm thinking of the long term, for the whole rest of the time they're on Earth, for things like energy, libido, vaginal health, bladder health, bone health, artery, brain. Without those hormones, the actual hormone, all of these things more or less decline. And when you look at a 90-year-old woman, you see a lot of loss.
Mhm.
And if you talk to a 90-year-old woman, as I have many times,
Yeah.
they'll tell you about the loss. So I don't know. We've all been through a lot of stress in this day and age. It's so different in ways. A lot of us are just figuring out things like relationship and marriage midlife.
Right.
Not a time to lose the libido.
No.
Not a time to have intercourse be painful.
No. I don't think there's ever a time for that.
Not a time to lose cognition.
Right.
So it gives us, at this time in history, those who have, our era is very different. I mean, couples used to stay together and we don't know what was going on behind closed doors, but now people are trying to figure out, a lot of people are trying to figure out, not everybody, but a lot of people are trying to figure out marriage.
Yeah.
There are 2.2 divorces midlife. So you want to approach that particular
Yeah.
time of life fully empowered. And a lot of women, having been householders and parents, mothers, midlife, they're just starting to get way, way interested in how can I impact and have a legacy on my life and my community,
Hmm.
on the whole planet. Their attention sometimes turns from raising children to, I now want to have an effect, and I want us women to have a big effect.
Yeah.
They need the energy, they need the cognition to do it. And so you get a woman who's got a career launching at the age of 50 and she's tanking and she can't sleep
Yeah.
tonight. So I say the best thing at this time in history that's available to us is those hormones. I'm an expert in women. Zillions of men are going through this too.
Right.
Viagra and these erection medications. Oh, lo and behold, they became extremely popular. Why? Because men are losing their testosterone just like women are losing their estrogens. So I don't know. What's defined natural?
Right. So
The thing we want to do is we want to lay it all out on the table and assist people to make what feels like the right choice for them, and dispel some of these myths,
yeah.
like hormones cause cancer. Wrong.
Right. Yeah.
Total lie. It's not what the medical studies show. It shows that hormones reduce the risk of cancer as opposed to a woman who's not treated with hormones.
Yeah. So now this topic, of course, is clearly really important for the women that are uh, going through that part of life, leading up to it, even maybe after. But it's important. I find it's really important for the men in their lives as well, that are supporting them, that are being affected by, they're losing their liveliness. Um, so do you have anything that you do to work with men as well yet, or is that something you're looking at down the road? Because we have, testosterone is a big thing, but we also have uh, some of the other hormones, estrogen, progesterone. They're just lower levels in men, right? Can you talk a little about that?
And they count. Testosterone in men is the main one, and it's got its own intricacies. And I've treated men myself, but I decided to zero in on treating women and get expert at that. I have colleagues who are expert at that. Earlier today, I was talking to one of them, inviting him in to do his teaching of how to treat men, us coming into a studio and filming him and getting that up. So it's not just a menopause method, which is going to disappear. It's Hey Lively, and it's going to include men and women.
Oh, great. Oh, so you're partnering and working together to.
There's 3 different experts
Oh,
in
excellent.
on treating men that we've been in conversations with for quite a while, and we know it's on our project list to get the training for men up there. It's a lot easier. It's a lot less moving parts. Women have got 4 hormones to deal with. Men have really got 2.
Uh-huh.
The others count. You're right about that. But really, it's
And,
about testosterone in men.
and since we're talking hormones, what about HGH? Have you gotten into that at all? I know that that affects us as well, and I'm curious how that plays into uh, the male and female hormones.
Well, I've dived in and out of getting interested and disinterested in HGH, human growth hormone,
Yeah, yeah.
over many years, and I've shied away from it. And in any given person, there's the big stuff, then there's the esoteric stuff. And I still place HGH in the esoteric stuff with a few things unknown. So you'd have to consult with an expert on HGH. It's expensive, it's not that easy to come by, and it's not the big stuff. You can bank on every woman and every man losing their estrogen, progesterone, testosterone, and DHEA, and a lot of us losing thyroid.
Yeah.
You can bank on it. It's happening. HGH is variable. A lot of us lose HGH, but whether it's an appropriate hormone to supplement and also how to supplement in an effective form, I've shied away from it. So I'm just not the expert. I'm sorry I can't answer that with expertise.
That's okay. That's
And I
okay.
don't take it myself, and that's an interesting thing to find out. Well, what am I doing?
Yeah. Yeah. So what are you doing to keep your hormone levels balanced?
Like some men, I'm very fortunate that my men decline. We all decline, but I'm okay with my decline, and it hasn't interfered with functions that really matter to me.
Hmm.
Occasionally, I've played around with topical testosterone in this organic oil. That's one of my favorite. And then my friends, my colleagues, the experts in men, have they've turned me on to something that stimulates the testicles. It's an injection. It's called HCG, and it's pretty esoteric. You don't need it. I would recommend testosterone itself. And again, I forget about it because I don't need it. So I'll go months without taking anything, even though I've got it. And so, I'm very fortunate in that way.
Yeah. Great. Well, I think we probably better wrap this up. I had hoped to get a little more into some of your life wisdom, but clearly a lot of your wisdom has come through in this interview already. So I greatly appreciate that, and the work that you're doing, especially with the women, but also with the doctors that you're training to expand your reach. Um, I feel that in our medical community these days, there's so many people, so many doctors that are misled and misleading their patients because they're not really truly looking at the actual results. They're pushing, like you said, a medicine or something that's just going to cover up the symptoms rather than uh, take care of and resolve the underlying issue. And in this case, instead of covering up, the cramps or the headaches or whatever else with, painkillers, that if we supply the body with the hormones, everything balances out, and then we don't have those symptoms anymore.
Can I add one other thing?
Sure.
Hormones lend themselves very well to testing. And the test that is the absolute very best is the 24-hour urine hormone test.
Uh-huh.
And what we've done in our method is define the parameters, what's too little and what's too much. You don't want to get too little that a woman's vagina and bladder and bones are not protected. And you don't want too much, otherwise you run the risk of overstimulating breast glandular tissue. So what's that target range? Well, we've defined that, and I've defined it from the medical literature. And so there's a lot of tests out there in the market, and without going into talking about the negatives with the other tests, I would like to say that the 24-hour urine hormone test is wonderful, and you can correlate it with the medical literature to define a proper target. Because the interesting thing is, in the old days, if a woman started on a low dose, gradually increased, and her hot flashes went away, we would say, great, you've landed.
Mm-hmm.
But I've been doing 24-hour urine hormone tests for 20 years now. And I did a study one year, several years ago, and I took 54 women who came to my office and said, hey, I feel great. I got the right dose. I know it. I feel good. I'm fine. Thank you so much. I said, now we're going to test you right now. A full 50% of those women were not on enough hormones to protect their bones and their vagina, which is sort of the bottom line.
Mm-hmm.
And 25% were on hormone dosages that I wouldn't want them to be on for 10, 20, 30, 40 years because it would put them at risk for increasing breast density. So I wanted to put in a plug for testing, and I wanted to put in a plug for proper testing, which is 24-hour urine hormone testing. There's a lot of variants out there. There's saliva, there's the urine 5-point, there's blood testing. They've definitely got some pros and cons to them. And just to give you my best opinion, it's the 24-hour urine hormone test. You want to find someone who's doing that.
Great.
And the other thing I'd like to say is if anyone is interested in treatment, we do a consultation with your doctor for no charge to help them do this method. If they want to get involved with the method, they join the method, they pay for the education and the mentoring, and we'll get them up to expert. That's what we do. We help physicians and nurse practitioners and PAs specialize so they become expert at this.
Amazing.
Yeah.
So they don't have to try and redo the science on their own, or
that's right.
While distracted with everything else going on. That you can work together and collaborate to support people in the best way. That's genius. So to recap, what I just heard was for all the listeners that are seeing a doctor that they like, if that doctor doesn't happen to already offer this sort of treatment, she can connect them with you so that they could be trained up.
We could offer them the training.
Amazing. I love it. Anything else, I guess any last words of wisdom that you might like to offer to the listeners that are going through their life awakening process, wherever they're at?
Well, this is a territory I love to do together. Is there any specific question that you might have in that regard?
So you talked about in your 30s going through a bunch of self-exploration, as have I, around that time frame. I think that's a good point in our lives where we have that deep drive to figure out who we are and why we're here. And I think sorting out our hormones is really supportive in that. That we're not feeling thrown off and wondering what's wrong with me, and that we feel like we still have all of that energy and vitality that we're meant to have at that point in our lives. And I guess.
Well, here's what's coming to me.
Okay, great.
So many men and women are interested in love and committed relationship and even marriage. And you'd think it was natural, but you look at the divorce rates, or if you've had any failures yourself, you know that there's challenges. And the main thing I'd like to say is, as basic beings, we're wonderful. We're living energy of love. And then we're still learning and growing. And the more you can learn about your own emotions and your own mind and come to peace with and have tools to heal what's uncomfortable in your own self, and you acquire the skills, you acquire the information, tools, and support. And there's so many therapists, seminars. This is a day and age rich with teachers and rich with programs. I say go for it now. Get skilled. And for men, you and I are men, and we have a special interest and concern in men. You want to learn how to be a mighty good man. I was a good man. I was, you know, if you looked at how I was living my life, you wouldn't see very much off. But what I learned was I did not know how to love,
Mhm.
and it was not good.
Yeah.
The barriers inside of myself of being at peace with myself, and more important than that, learning how to love another person, and this is beyond gender, could have been men, could have been women. For me, it was women. It's I did not know how to love in an intimate relationship, in a marital relationship, and there was a lot to learn, a lot of skills, a lot of tools, a lot of work that I could do in myself in the comfort and safety of my own home. And I just encourage young men to take this on. I encourage men of any age,
Yeah.
learn what it is to love, learn what it is to heal yourself, get the support, join the groups, join the seminars, go to therapy. And you know, you sometimes have to courage up. You have to pull yourself up by your bootstraps because you're hurting.
Yeah.
That hurt is the doorway to your healing. So I know you and I speak of one voice here, Jeremy, is
Yeah.
go out there and get it. Because
Correct.
if you learn how to love and you learn how to connect to another human being, like Jeremy and I have had the great pleasure to do with each other, for example, and many others, this is what life's about. This is what health's about.
Yeah.
Learning how to love, come to peace with yourself, connect with others. It's a miracle. And it's good for health. And it's what living is. And you get to have the relationships and the beauty and the joy and the love. That's what is nurturing and healthy for us. Yeah, I like supplements. Vitamin C is a good thing. And so are a lot of others. And so are hormones. But nothing replaced human development to where we get wise enough, strong enough, courageous enough to succeed at love and connection.
I feel like that's one of the biggest things that I have noticed and felt drawn to in you is that sense of love that just pervades from you, in who you are and what you do, or how you do what you do, and I think that it's also probably why you got onto the journey of how can I support women in a bigger way, in a better way, and a more natural way that actually supports them beyond just making money as a typical allopathic doctor. That you niched your way into how you're truly deeply helping people, and I super appreciate that. I feel like we vibe so resonant on that. Um, that it's love within, and as men, I think that's what everybody really truly wants and desires from the men that we surround ourselves with. And so to be that, to share that, to encourage that in others, I super appreciate that, David, for being on, and for doing the work that you do.
Thank you, Jeremy.
All right. And thanks to the listeners, and hope this is something that can improve your lives as well. Much love.
All right. Nice to see you as always, Jeremy. I love you, Jeremy. Talk to you later.
Love you, David. Thank you. Take care.